Hello, everyone. Thank you for your hospitality, Denise and everyone on your staff. It's very nice. My name is Michael A. Weiss, and I have severe Crohn's disease. And for those of you who don't know what that is, it's a chronic, incurable autoimmune disease that primarily affects the gastrointestinal tract, but it really could affect any part of the patient's body, from the eye to the, let's say, your big toe, okay? Now, this particular subject matter is how the digital health life affects real life. Well, in my case, that made me form this 501c3 nonprofit called the Crohn's Disease Warrior Patrol. Sort of has a corny name, and it was done on purpose because I found that when I would go onto healthcare social media platforms, such as various Facebook groups, or Google communities, or LinkedIn groups, or reading Tumblr blogs, or participating in different tweet chats, I would see patients talk about things that were so frustrating. I went through them in 1984. Why are we still going through them? And it really bothered me, and it seemed like patients knew more about their disease than their doctors. Having said that, there are tremendous amounts of compassionate doctors, but it's such a frustrating disease that they need to listen to patients more. So I thought about that, and I formed this organization because I kept seeing these types of issues. A patient would put up a note and say, my doctor said it's time for me to go on biologics, and he asked me which one I'd like to be on. Makes no sense. They're different drugs. In fact, even doctors don't truly understand the way to apply them because some doctors use a top-down approach, some use a bottom-up approach. Top-down means start with the most potent drugs and go down. I believe it works better with pediatric patients, from what I'm told. Bottom-up is use the most conservative drugs until you have to use the really serious ones. But there are a whole host of other issues, like someone had their colon removed through a colectomy, and they had ulcerative colitis, and they said, my doctor said I'm cured now. They're not cured. They may be cured of the gastrointestinal effects, but they're not cured of the autoimmune effects. There are other patients in severe pain, and they would say, well, what do you do for pain? And I would answer 5 or 10. I get a million. I get so many a day, but I make it a point to answer at least 5 personally. And some would say, what do you do for pain? And I'm amazed that their gastroenterologist never mentioned to them that there's a medical specialty called pain management. It's almost like we're living in the dark ages. Some patients, when you have an intestinal obstruction, you go into the hospital, and to alleviate the pain, they give you what's called an NG tube. It goes through your nose and then into your stomach to remove the contents. Basically, they're putting a human siphon in you, which is fine, but you'd think with all the technology that this would have advanced. So I decided to form this entity because I thought that patients helping other IBD patients, IBD is an acronym for inflammatory bowel disease, well, patients helping other IBD patients is often the best medicine. And I say that with all sincere due respect to doctors and other medical professionals. But many times their hands are tied, whether it's the health insurance company, the time constraints, or sometimes doctors just get a case that's frustrating. It needs a second set of eyes. So I think patients can play a huge role. It's the been there, done that syndrome. Let me share with you what I know. And when I formed this, it was all around this basic premise, that one simple statement. But what I want to leave you with is, it's actually a joke, which is what helped me come up with that statement, because it's so applicable in an incurable disease like Crohn's, where the drugs, like the biologics, which are the most efficacious, sometimes have side effects that are worse than Crohn's disease. Sort of counterintuitive, but it goes like this. A 35-year-old man is walking in the streets of New York City, and then all of a sudden, a sinkhole, the ground opens up, 40 feet wide, 40 feet deep. He's stuck there, he can't get out, and he's screaming. And the first person to walk by is a doctor, and he says, "Doc, can you help me get out of here?" The doc writes a prescription, drops it down. Guy's like, that's very nice, but what's that going to do for me? And then 10 minutes later, a priest and a rabbi walk by. Please help me, help me. They say a prayer. Again, didn't help him. The next time, his best friend walks by, and he says, can you help me? The best friend jumps in the hole, and he looks at his best friend, and he says, why are you jumping in here? I can't get out of here. And the best friend says to him, I jumped in because I've been down here before, and I know the way out. And that's what my charity is all about, matching experienced patients with newer patients to help them get out of the hole. So thank you. Oh, one last thing. We have a T-shirt, and it's for Denise. She's an honorary member now of the Crohn's Disease Warrior Patrol. So here you go. All right. There you go. And on the back of the shirt, you can see it says, patients helping other patients is often the best medicine.
Yeah,
Yep.
I have to say that Frank Antwerpus named me a health warrior last September, correct? Yes, so I guess I'm a double warrior now. So I should also tell you that Michael is one of the funniest people I know, and that he used to be an entertainment lawyer before Crohn's put an end to that. But I'm sure he was keeping them all in stitches, if I may say.
Was I an entertaining lawyer or an entertainment lawyer?
Well, I thought you were both.
That's what, yeah.
Yes, right.